Assalamualaikum doctors. In this video I am discussing how can we take the orbital cellulitis history. So it is mainly come as a eye swelling and the main scenario DD is come orbital cellulitis or nephrotic syndrome. So if I am telling some DD, periorbital edema, it can be bilateral or unilateral. Bilateral systemic signs of water overload. So water overload and systemic sign, it is nephrotic syndrome. Bilateral eye swelling with change in the appearance of eyes, systemic signs of active thyroid, hyperthyroidism. Also bilateral eye swelling, sudden onset of excessive tearing, no change in visual acuity, allergic reactions. Now about unilateral. Unilateral periorbital edema, no fever, insect bite or eye trauma, and fever, cellulitis. Now I am discussing orbital cellulitis history. How can we take? First of all, eye swelling is our chief complaints. Is it unilateral or bilateral? So single eye or both eye involved or not? Onset, course and durations, what make it better and what make it worse? Then as usual, any diurnal variations, any swelling in other parts of the body. Then there is any sequence of the swelling, red eye, excessive lacrimation, oozing pus, affects visions. Then pain when moving the eyes, bulging eyes, light intolerance, green and red color differentiations. Generally, we ask about the fever, weight changes, level of activity, sleep, sting bite around eye or other elsewhere. Other concerns like any dysmorphic features, chronic illness or long-term medical conditions. So here chronic illness, long-term medical condition is very important because the cause can be nephrotic syndrome. In eye swelling history analysis, I am telling eye swelling, is it unilateral or bilateral? Onset, course and durations, what make it better and what make it worse? Any diurnal variations, any swelling in other parts of the body, sequence of the swellings, red eye, excessive lacrimation, oozing pus, affects visions, pain during moving the eye, bulging eye, light intolerance, green or red color differentiations. General about the fever, weight changes, level of activity, sleep, sting bite around the eye or elsewhere. Other concern like any dysmorphic features, chronic illness or long-term medical conditions. Now systemic review one by one. First of all, CVS, number of pillows. If more than one, ask about the before, how much pillow he used, chest pain, exercise intolerance, awareness of heartbeats and blood pressure. CNS about sign of increase in intracranial temperature, headache, fainting, altered consciousness level, unusual movement, fits, hearing concern, unusual gait and facial asymmetry. Urinary about the change in the pee color, amount, frequency, pain, frothy urine, recent bug and urinalysis. GIT increase the tummy size, tummy pain, loose poo, throwing up and yellow eye. Chest about the coughs and colds, recurrent bugs, rapid breathing, noisy breathing and oxygen saturation. MSK skin pots, lump, joint pain, joint swelling, changes in the hair and nails. Hematology about the pallor, bleeding, bruising and recent bug. Endocrine, heat intolerance, blood sugar measured. Past history 5T IOA, trauma, traveling, any blood transfusion, any surgery, any admission previous, these are drug, sting bite, previous admissions. So very important, previous admissions. Then perinatal history, if age, previous admission, we can differentiate it from the nephrotic syndrome. Perinatal history, if age is less than 1 year, ask about the birth weight and hypothyroidism screening. Puberty if relevant. Vaccination is missed any shots, extra shots and annual shots. Allergy important, nutritional edema. Allergy is very important because eye swelling, one is allergic reactions, genetic edema. So we can ask. Development plus growth chart, family history of similar condition and consanguinity, social finance plus home, psychological, school impact, how does his condition affect the family? Is there any repeated ear infection, nasal discharge? Is it upper eyelid or upper and both lower? So this is how can we take the history. Now I am telling the differential diagnosis of eye swelling. First of all, unilateral, then bilateral. Unilateral local cause or any anaphylaxis like allergy, sting bite, eye trauma, orbital cellulitis, eye infection secondary to facial palsy and exophthalmos. Where bilateral cause are first of all nephrotic syndrome. If nephrotic syndrome, we can understand that we ask when first diagnosis, relapse occurs, steroid dependent and steroid resistant. So this we need to search. Nephrotic syndrome eye swelling, is it first diagnosis, relapse, steroid dependent or steroid resistant? Then nephritic, orbital cellulitis, anaphylaxis, hereditary angioedema, cardiac failure, renal failure, liver cell failure, malnutrition, kwashiorkor, protein losing enteropathy and exophthalmos. Note, nephrotic on steroid decrease the immunity, so orbital cellulitis can be present. If known case of nephrotic syndrome, first DD I am telling eye swelling, commonly come on exam, anaphylaxis, angioedema, malnutrition, nephrotic syndrome, DD, these are. Okay, so if known case of nephrotic syndrome are, we ask like when, where, by whom was it diagnosed, Test done. Biopsy if frequent, steroid dependent or resistant. Steroid given, dose, duration, effect of the treatment, improve or not. So any disease giving steroid, we effect, any side effect of the steroid present or not, we ask, like excessive hair, increasing weight, these are. Then recurrence of the symptoms, when? During steroid withdrawal or after. Side effects of steroid, other drugs given. Follow-up is team or follow-up the visits, regular on the treatment or not. Who gives him the treatment, diary, duration, bracelet or emergency plan card, operation, admission, frequency in the ward or ICU, trauma, travel, transfusion, extra shots, vaccination and sting bite. So this is all about how can we take the eye swelling history. It is really very, very important because it comes 2024 multiple times. Okay, thank you.